This is a quick review for the test on physical assessment and diagnostics. Looking at how a patient should be positioned. The upright position with the arm supported increases lung expansion and allows fluid to collect at the lung bases and expands the intercostal space so that access to the pleural space is easier. Describe stethoscope placement over lung tissue. It should be placed over lung tissue and not over bony structures, and breath sounds should be compared from side to side. The appropriate suction wall setting pressure, this should be at 80 to 120 millimeters of mercury. After a patient aspirates, how long before you hear crackles? Well, it is not immediate, and crackles are not present immediately after aspiration since the inflammatory process can take time to occur. How would you assess a patient's ability to swallow? A speech therapist may use a colored drink like grape juice to determine whether or not a patient can aspirate. Even if the patient is able to talk, aspirations can still occur. Looking at the breath sounds, wheezes are high-pitched sound, and they can be heard on the inspiratory and expiratory phase of the respiratory cycle. Crackles are low-pitched bubbling sounds. Crackles in the lower half of the lungs indicate that a patient may have an acute problem such as heart failure. Pleural friction rubs are grating sounds that are usually heard during both inspiration and expiration. Bronchial breath sounds that are abnormal are heard at the lung bases. Vesicular sounds are low-pitched, soft sounds heard all over the lung areas except the major bronchi. Adventitious sounds are extra breath sounds like crackles, wheezes, rhonchi, and friction rubs. Diagnostic studies. Bronchoscopy. Because a local anesthetic is used to suppress the gag cough reflexes during a bronchoscopy, you as a nurse should monitor for the return of these reflexes before allowing a patient to take oral fluids or foods. Blood-tinged mucus is not uncommon after a bronch. They are used to inspect the changes in the bronchial tree. This is not used to assess for vascular changes. Pulmonary function tests. Bronchodilators are held 6 hours before a pulmonary function test so that a baseline assessment of airway function can be determined. So testing is repeated after a bronchodilator used to determine whether the decrease in lung function is reversible. There is no need for the patient to be NPO. Oral corticosteroids should be held before a pulmonary function test. Rescue medications, the bronchodilators, would not be given until after the baseline pulmonary function was assessed. For a pulmonary function test, the patient should inhale deeply and exhale as long, hard, and fast as possible. Spiral CTs are most commonly used tests to diagnose a pulmonary emboli. A chest X-ray might be ordered. A PET scan is most useful in determining the presence of malignancy. A peak flow. The patient's peak flow reading is used to determine if the condition is worsening. If the reading is decreased, then a patient should take the bronchodilator and recheck the peak flow. The patient should exhale quickly and forcefully through the peak flow meter mouthpiece to obtain the readings. After the peak flow is done, the patient will look to see whether or not they're in the green, yellow, or red zone. The green zone is that the peak flow rate is 80 to 100% of their personal best and indicates that the asthma is under control. They'll take their preventative medication as usual. The yellow zone is caution. The peak flow rate is 50 to 80% of the patient's personal best. And this is an indication that the asthma is getting worse. The signs and symptoms may occur such as coughing, wheezing, or chest tightness, but the peak flow rates may decrease before symptoms appear. The patient may need to increase or change their asthma medications and will need to talk with their physicians. Readings in the yellow zone indicate a decrease in peak flow. The patient should use their albuterol meter-dosed inhaler. The red zone, this is danger. The peak flow is less than 50% of the patient's personal best and could indicate a medical emergency. They may have severe coughing, wheezing, and shortness of breath. They'll need to just stop and use that bronchodilator or any medication that they're given to help open their airways. If it's an exercise-induced asthma, then Intol may be appropriate. The principle of the flutter as a mucus clearance device is based on its ability to vibrate the airways, which loosens mucus from the airway walls. It intermittently increases endobronchial pressure, which helps maintain the patency of the airways during exhalation so that mucus does not become trapped as it moves up the airways. Accelerated expiratory airflow, which facilitates the upward movement of mucus through the airways so that it can be more easily cleared.